The biggest and most expensive part of Maine state government is the Department of Health and Human Services. It spends more than $4 billion a year and is involved in the lives of more than 300,000 Maine people. The woman who is taking over that department told lawmakers today DHHS needs to change to provide the services needed by so many, but also be good managers of money. NewsCenter's Don Kerrigan has the story.
No state agency is more consistently controversial than DHHS. That's largely because of the big budget and the work it does. But during the past 8 years, those controversies were more numerous than ever. Welfare cuts and new restrictions on things like food stamps and EBT cards. Tens of thousands of people dropped from Medicaid. Ongoing disputes over mental health and other programs.
I bring a breadth of experience that will help us tackle these challenges head on.
Enter Jean Lambrou, who grew up in Cape Elizabeth but has worked for years in Washington. She was a leader on health policy in the Obama White House and helped write the Affordable Care Act. Tapped by Governor Mills to take over DHHS, Lambrou told lawmakers she sees a lot that needs to be changed.
Governor Mills wants to restore trust in state government, in particular at DHHS. Systems to protect vulnerable children have deteriorated. Positions to protect public health, including public health nurses, have been cut and diverted to different work.
Lambrou's biggest job to start with is expanding Medicaid, Maine Care, to an estimated 70,000 to 80,000 more people. Republicans have continued to warn about the cost of doing that and the need to find what they consider sustainable funding.
When we're expanding Medicaid and, the people did vote and they voted for it, we have to be very careful how we finance that and what we look at, and we have to make sure that we are not taking away from some people, especially our most disabled.
In the hearing, Lambrou said she and Mills will pay attention to the money.
How can we do this over time in a way that makes good health policy sense, good fiscal sense, but not just for the state government, also for the larger community.
Lambrou also answered other Republican concerns about work requirements for welfare, saying she and the governor support programs to help people get ready to work. Committee Democrats agree.
As Acting Commissioner Lambrou spoke, and as the governor has spoken, getting people healthy so that they can work, and then having them figure out what kind of job and how to be good employees is a real focus.
Jean Lambrou also talked about Maine's Child Protective Services and the need to continue strengthening that program after the tragic deaths of 2 children last year. Like commissioners before her, Lambrou said that is already one of the things that keeps her awake at night. In Augusta, Don Kerrigan, NewsCenter, Maine.